Always remember, in any disease, if there is vulgaris term, then it means it is the most common. For example, most common pemphigus is pemphigus vulgaris. In pemphigus vulgaris, antibodies are present against intercellular substance. Acantholysis is characteristic of pemphigus vulgaris. Loss of intercellular adhesion between keratinocytes is called as acantholysis. And acantholytic cells are epidermal cells or keratinocytes. Zang cell is a keratinocyte. Acantholytic cells in pemphigus is cell with hyperchromatic nuclei and with a perinuclear halo. This is also called in particular as morning edged cells. Okay, coming to associations with pemphigus, the most common association is NHL, non-Hodgkin's lymphoma, followed by chronic lymphoid leukemia, followed by Castleman's disease, thymoma, and myasthenia gravis. Paraneoplastic pemphigus is an important concept. Here, Anhalt criteria is used for the diagnosis. Drug-induced pemphigus is most commonly caused by penicillamine. Treatment of choice for dermatitis herpetiformis is dapsone. But be careful, if in the options there is gluten-free diet, then it will be the answer, better answer compared to the dapsone. Because dapsone, we can say that it is a drug of choice. Mucosa is never involved in pemphigus foliaceus. Causes of erythema multiforme. The most common cause is herpes simplex virus. It can also be because of drugs or it can be idiopathic. But it is not caused by human papilloma virus HPV. Target or iris lesion is seen in erythema multiforme. Epidermolysis bullosa is because of genetic cause, and in particular congenital dystrophic variety of it is due to the mutation in the gene encoding for collagen type 7. Dermatitis herpetiformis DH shows granular deposition of IgA in dermal papilla. Direct immunofluorescence is positive in pemphigus group of disorders. Skin disease not showing direct immunofluorescence are Darius disease and Haley disease. So DF will be negative in these diseases. Intraepidermal intercellular IgG deposition is seen in a fishnet pattern in pemphigus. Bullous skin lesions are seen in impetigo, diabetes mellitus and porphyria. But remember, it's not seen in lupus vulgaris. This was asked as an all except question. Which layer of the skin causes vesicular change in case of a burn? It is subepidermal or dermis. In Zang smear, multinucleated cells will be seen in chickenpox. That is varicella. Acantholysis is seen in Haley disease, Darius disease, pemphigus vulgaris, staphylococcal scarlet syndrome. Acantholysis is seen in epidermis. Acantholysis is due to the destruction of the intercellular substance. Nikolsky sign is negative and tense bullous lesions are seen in bullous pemphigoid. Haley disease is also known as benign familial chronic pemphigus. In dermatitis herpetiformis, administration of dapsone is used as a therapeutic test. Dapsone will be given as a therapeutic test in few patients in whom there is a clinical correlation with the patient presenting with intense itching and papillovesicles. Spontaneous remission is most frequent with herpes gestations. This point is actually already covered. Pemphigus foliaceus never involves mucosa. See, in scabies, you will not see any papillovesicular lesions, but in infant, we can see papillovesicular lesions on palms and soles, face and trunk. Disease of derma epidermal junction is bullous pemphigoid. Remember, tombstone appearance is seen in pemphigus vulgaris. String of pearls, cluster of jewel, crown of jewel appearance is seen in linear IgA disease. Drug of choice for linear IgA disease is dapsone. Antibody agonist BP120 and BP180 is seen in linear IgA disease, whereas antibody agonist BP230 and BP180 is seen in bullous pemphigoid. Remember, BPAG2 is more common. Tissue transglutaminase 3 is involved in dermatitis herpetiformis. A patient came with tense blisters on normal skin as well as over arterial blocks. This is a clue given in the question. Here the diagnosis will be bullous pemphigoid. Bullous pemphigoid is a subepidermal group of disorder, and here there is no acantholysis seen because epidermis is the one which contains keratinocytes, but bullous pemphigoid is subepidermal. Bulla in staphylococcal scarlet skin syndrome is intraepidermal. Diskeratosis is seen in Darius disease, Bowen's disease, squamous cell carcinoma, and actinic keratosis. Rarest variety of pemphigus is pemphigus vegetans. Most common site of herpes gestations is periumbilical region. In pityriasis rosea, there will not be any bullous lesions. Superficial partial thickness burn will involve papillary dermis. Nikolsky's sign will be positive in pemphigus vulgaris and Hailey-Hailey disease. We have already discussed that pemphigus vulgaris will show row of tombstone appearance. The reason for this is that hemidesmosomes are not affected in pemphigus vulgaris. Bulla spread sign is negative in pemphigus foliaceus. The reason is because it presents with scaly lesions. Dermal blisters will be seen in burns and bullous systemic lupus erythematosus. Sinner-Usher syndrome is associated with pemphigus erythematosus. Dermatitis herpetiformis is associated with gluten-sensitive enteropathy. Corps and ronds are seen in Darius disease. It is also called as keratosis follicularis. Asbo-Hansen sign is the extension of the blister to adjacent skin when pressure is applied on the top of the bulla vertically. Drug of choice for pemphigoid herpetiformis is corticosteroids. Rituximab is very much asked in recent times. It is an anti-CD20 monoclonal antibody. Dilapidated brick wall appearance is seen in histopathology in Hailey-Hailey disease. So the links for the same I will put in the I button above.